What are the chiefest benefits for a patient to be a part of clinical trial?
The new treatment arm of a trial, or the standard treatment of the trial, is that patients get more attention from their clinicians, and therefore the quality of the care that they get is generally better. Because you're more closely monitored when you have a trial, your overall standard of care is better. And it seems also that hospitals that conduct a lot of trials, it seems to have benefit across the whole of the treatment. So what we've looked at in the UK is those centres that are more active in terms of trial recruitment also seem to get better long-term outcomes. So the example we've got is for cancer of the bowel, and we looked at hospitals that didn't do many trials versus hospitals that do a lot of trials, and there is an overall benefit to patients with cancer in those hospitals that do a lot of trials in terms of their long-term 5-year survival and the early complications that they have. They have less. So in organisations that are actively involved in clinical studies, the discipline of that clinical study really helps improve the overall care of the patient.
Can you tell us a few words about It's OK to Ask campaign? Why is it important in the context of clinical trials?
So for me, the most important thing about clinical trials is it gives the very best of care to patients. But what we have to make sure is that patients understand that. So the reasoning behind the OK to Ask campaign is to get patients to ask about research. Because what we want our patients to have in the UK is access to the most modern, up-to-date therapies and treatments. And sometimes we find that doctors and nurses are resistant to getting involved in research because they assume that patients don't want to be involved in research. But what we found is, in actual fact, there's a huge sense that patients do want to be involved in research, and therefore we think that by getting patients involved, giving them permission to talk to their doctors and nurses, will actually get the doctors and nurses to think more about research. So it's actually putting in the control of research into the hands of patients.
Medical science is getting more and more complicated. We're talking about personalized medicine now. How does it change the approach to clinical trials in the sense of the need for cooperation of many different institutions and clinicians to get the right groups of patients?
So the benefits of personalised medicines is that you get a medicine that's very specific for your type of the disease you've got. The difficulty is that whereas we used to treat cancer as one disease in the breast, we now know that there are so many genetic subtypes that we have to tailor the treatments for each individual patient. But we need to know what those treatments are. And to do that, we have to find those patients with those individual disease areas. And you can't do that in one organisation. You've got to get a much bigger population of patients with that disease. So by networking between organisations, between hospitals, you can then get the patients gathered into the clinical trial more quickly, and you get the sufficient numbers of that subtype recruited more quickly. So I don't think there's any other way to do clinical trials in the future apart from linking institutions. The days where an individual hospital competed with another hospital for doing a trial have gone. Because we used to be able to recruit every patient with breast cancer into a single trial, a single drug treatment. We're not going to be doing that in the future. So that hospital will only have 2 or 3 patients with that subtype, and that won't be enough to give us the evidence to make that treatment widely available. That's why we have to link hospitals together.
What would you advise Poland and the people interested in clinical trials? What should we change and what to focus on to boost clinical trials in our country?
So I think the first thing is to get the message to patients, the benefits of trials. That's the reason why we have the OK to Ask campaign, is to get that message to the public. Because if the public and patients demand more involvement in research, then that's a very strong message to both the government and to the industry, and particularly to the professions, to get them involved in research. So I think the first thing to do is to really get the patients involved. The second thing is to make sure that it's easy to conduct trials within the Polish healthcare system. And for that, you have to look at the bureaucratic processes that are going on at a government level, and you have to rationalise them and streamline them. Because all my evidence in the United Kingdom shows is that research is actually a very safe pursuit. It doesn't create complications. It actually has the opposite effect. It seems to have a benefit to patients in terms of the quality of their outcome. And therefore, we need to get that message across, that by making research more easy to perform within the healthcare system, then we're more likely to get better results for patients, and patients' outcomes will get better.